Hello, guys. Okay, I hope you can hear me well. Let me double check. Yes, I think you can hear me well. Okay. So, so today's lecture is part of the skeletal system, the joints. We are going to look into more detail about the joints. You guys should already learn about the bones. Um, so this is how bone and bone meet each other, the joints. So let me share my screen. All right. So that's this one here. We're gonna use several video. I don't want to create a long video, so I will create short video, and so easier for you to digest. The first one is this first one. So what is joint? A joint. A joint is where two bones meet. So joints have to uh, meet that requirement. That is the connection or the connection between two bones. Yeah. So that's a joint, and the joint allow us to have the movement. So it's not like single bone. You have several bone, and allow us to have, you know, bone and bone like put together and allow us to have some stability of some movement. Joint is not just joint itself. When we study it, we look at the joint. We gonna look at different joints. We gonna classify different joints. Um, uh, we can classify, but it's not just joint, not just bone. We also have a ligament, some additional connective tissue to support, to connect bone and bone. Ligament is to connect bone and bone. And we also have tendon. Tendon is the part of the muscle that connects muscle to the bone. And so altogether, this stabilize or support the joints. We can classify joints by depending on the joint structure. Some joints, the parts the way they put together, you can consider like glue. The way they glue together, it could be pretty tight glue. So the joint basically is movable. You cannot move it because it's very tight. Some joint is like hinge, like it's connect, but it can move. Like the door, like you can move the door, like hinge. You can move the door. You can move the finger. That's two piece. You can move the finger. So some joints are allowed to get to move. Uh, and so the way we glue them are differently. For we can basically have three way we can connect two bones. We can either glue them very tightly, or we can allow some flexibility. So we can look at their classify the joints based on their structure, or classify the joints based on their function. Function basically is immovable, like you cannot move it. Not movable at all. Like our bone, we know that the skull has different bones, and the bone and bone has suture. Bone skull cannot move. Is pretty tight, and so the joint is immovable. Some allow a little bit movement, and some allowed very flexible movement. So we can look at the structure and the classification, structural classification, and the functional classification of the joint. So let's take a look at the structure classification. So this is basically what components we use to put two bones together. We can use connective tissue. We learned about the tissue already. We learned that there are uh, four type of tissue. You should know that already. And one type is a connective tissue. And we can use very uh, thick or very uh, like that fibrous tissue. That's yeah. basically it's very, very hard. It's not easy to have some flexibility or to move around, and so that's a fibrous. So if that is made of the fibrous here, fibrous connective tissue. If it's made of that, this very basic example is our skull. Two bones are sealed together. What connect them? Those fibrous tissue. Yeah. So you can we observe those. You can see that it's pretty tight. So that's one type, fibrous joint, fibrous tissue. The joint will be the fibrous joint. Suture is one of them. We've mentioned it many, many times. Yeah. The other one is not like fibrous. Now we have a little bit cartilage. Cartilage basically is the is 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 like soft bone, like here, cartilage, right? Cartilage, soft bone. Yeah. Um, yeah. So we can have those cartilage to put two bones together. Yeah. So it's connective tissue. Bone is connective tissue. Yeah. So connective tissue have different type of connective tissue. There are two subtype of this cartilage. So cartilage can be very transparent, as we learned in our early lecture when we talk about the bone and the cartilage, the skeletal system, can be very watery, contain more water. That's called hyaline cartilage. Or it can be more matrix, like less water. That's called fibrocartilage. Cartilage. Yeah, fibrocartilage. So there are two type. So yeah. So with this one, some of those will allow you have some mi minor movement. Not very much, but minor movement. The one will give you more movement is this one. It's called synovial joint. This is very interesting. A lot of and because it is allow more flexible movement. Basically, all the movement that you can think about the joints, a lot of those movements are synovial joints. So if this is your first time learn about this, you need to um, just remember it, repeat that. The way to memorize it is repetition. So repeat it. Synovial joint. Synovial joint is very interesting. Two joints when two bones join together. I can draw here. When two bones join together, let me see if I can have some pens, all right, annotation. When two bones, one bone, right? And then here is another bone, right? Two bones join together here. They they uh they are let me see that here. They are they are uh they are present in a different world. So here is tissue, right? Here is air. But here you can have something like this. So here is the whole thing. The whole thing. The whole thing is wrapped by a membrane, a capsule. So basically this whole thing is wrapped by this membrane, the capsule. And inside of this capsule, inside of it, you have fluid. Yeah, fluid. So that's very interesting part. So the joint, you allow it has some lubrication, some fluid, and yeah, here is. So it's very good, right? It's like very, very elegant design that two bones put together, but it's not dry bone. You probably will put some lubrication on it, but it will get dry. And now we wrap it around, like band-aid or something, wrap it around or like tape, wrap it around, and so it's sealed, and the fluid inside, and it allow more lubrication, and yeah, and that's very unique. So this space is called synovial cavity, and this capsule is called synovial capsule, and the fluid is called synovial fluid. Yeah, we're gonna look into it. So there are three ways we can uh, put bones and bones together: either fibrous joint, cartilage joint, or synovial joint. So this is how we classify them based on the structure. Let me erase this one. I don't need this one anymore. Yeah, yes, I think I can. No, come on. Right here, I can erase it, right? Yes, clear all. All right, so that's that. So that's structure classification. We can classify the joint also based on their function. This is more common. Uh, yeah, not actually more common. Functional, yeah, functional, yeah, actually more common. All right, so in functional annotation, all right, functional annotation, we can classify them based on how much they can move. They can either immovable, with this one we call it synarthrosis. So this is if this is new word to you, you just repeat it many times, and then it become part of you. Then you memorize it. Syn synath synarthrosis here. You know, throsis, throsis. Syn is together. Arthrosis is joint. Arthros joint. So synarthrosis is one that syn is together. You cannot move it. It's bound together. A little bit movement is called amphiarthrosis. Yeah. And the one that allow you to be freely movable, more freedom to move, not totally free, like, more freedom to move. It's called die. Die means through. Die means through. Die, like go through, diaphragm, through. Diarthrosis. Yeah. So, what is synovial be part of these three? Synovial structure allow you to have diarthrosis. And how about fibrous structure? Fibrous joint. Fibrous joint is very much give you thin arthrosis. Thin arthrosis because you cannot move like suture. How about the cartilage? Here we have the cartilage, cartilaginous, cartilaginous. It can give you some small movement right here, amphiarthrosis. So it's a little bit like one-to-one relationship. Like fibrous is very much all amph symarthrosis. Cartilaginous could give you not necessary because we will see some cartilaginous doesn't give you movement at all, but could give you a little bit small movement, which will be the what's that? Amphi right here. Amphi. Amphi means both side, like yeah, amphi. Amphiarthrosis. How about synovial? Synovial allow you to have more free movement. I just have that joint there. So it's what's that? It's the diarthrosis. So that's that. So what are the example? Right now we classify them or our body's joints. You can classify them based on the structure, look at the components, or look at their function. Can you give me some example? Sure. Let's give you some example. So for the synarthrosis, is syn means together, is immovable. You cannot move it. A typical one, I repeated this probably fifth time already. Suture is one. And what's the structure of it? Is fiber structure. Yeah. So suture like this one here, those are sutures. Uh, so that's that. So that example, quiz question can be, which 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 either way, suture is part of what is what type or can be classified into what type of the joint. It's seam arthrosis right here, seam arthrosis. Another one, all right, so that's the one we know. Another one also commonly mentioned is called gymphosis. This is the plural. Singular is gymphosis. All right, gymphosis. Gymphosis is the joint between your tooth. and the bone. So your tooth is not movable, right? You better not to move. It's better not to be movable. Here you have a very tight. This yellow orange part is a tendon. Sorry, not tendon. Tendon is to connect with muscle. This one is a ligament. Ligament is to connect bone and bone. And so this ligament is fibrous tissue. This ligament is called peridental ligament. If this ligament, that's why, you know, is if the person have periodontitis infection, this part will get eaten by bacteria, then you're gonna lose your teeth, all right, tooth. Yeah, so that's that. So we want to make sure you need to use your floss, like, to clean it and maintain your dental hygiene is very important. We don't want to lose this piece, otherwise the tooth is gonna get falling off. Yeah, so that's the kyphosis. Just some anatomy here. We learned this one already. Alveolar process. You can find it in uh, the top and the bottom mandible maxilla, right? Yeah, and yeah. So that part we know already. This is teeth. Teeth is also bone. Tooth is also bone. And yeah, so kyphosis is a thin arthrosis. It cannot be moved. What else? What else? All right. So this one is fibrous tissue. Fibrous tissue. We have one example, maybe two example, that is caused by the cartilaginous tissue. All right, cartilaginous is not so dense. It's more watery. Is there are also different type of cartilage, but this one is not so dense. So what example is that? One example is epiphyseal plate. So epiphyseal plate, if you remember, epiphyseal plate right here is the cartilage when when a long bone uh, grow to mature. And so before they mature, a long bone has two pieces. Here is the epiphysis, here is the diaphysis. And this cartilage connect these two. And this long bone is not going to move. So this is very, very immovable. Yeah. So that's one example. Another example is syn sorry, synchondrosis right here. Here is the uh sternum and clavicle, and this part is also pretty tight, and it's formed by the cartilage right here, cartilaginous. Yeah. So that's the typical example right here. Suture, kyphosis, and epiphyseal or synchondrosis. And yeah, so you can have fibrous structure, cartilaginous structure, but their function is, if we classify their function, they are all synarthrosis. So that's the first class. How about the example of the second one? Amphi, a little bit movable. Amphiarthrosis. So this one is a little bit movable. Do you have some example? There are uh, several example I can give you, and let's classify them into based on they have two subtype. Because amphiarthrosis can be made by fibrous tissue or made by the cartilage tissue. So if it's made by the fibrous tissue, it's called syndesmosis. Uh, One example, fibrous tissue right here. One example is the joint between tibia and fibular. It's called tibial fibular joint. All right. Does it ring the bell? Do you guys remember what's tibial fibular? So let me show here, right here. So this is tibia. This is fi, uh, fibular. And this here you have the membrane. here these two bones connect. Um, and so where is it? It's basically in our the lower leg, right? Here is the top. Here is your knee. Here is your ankle, right? Yeah. So now you can see that tibia and the fibula uh, form two joints. Only the distal one is is uh is amphi is amphi uh amphithoracis right here. Only the distal one. Yeah. The proximal one is actually more freely to move. It's part of the knee movement. Allow your knee to move, like rotate. Yeah. So allow your ankle to rotate. Yeah. Ankle to rotate. It's knee, but actually this ankle to rotate, right? Yeah. So that's that. So yeah, so that one right here, this one is a little bit movable and it's made by fibrous joint called syndesmosis. Right? So that's that. Another one is s- symphysis. Symphysis is made by the cartilage. It's not exactly total cartilage. It also have some fibrous. So this is usually a disc right here, a disc. It's the disc, and so it's cartilage, but it has some fibrous membrane to cover it. We have two examples. One is the intervertebral joint, is in our spine. The other one is pubic symphysis. So let's take a look. So we talked about this one already. Um, Pubic symphysis, uh, it's the joint between left and the right pubic bones and then joined together in the front. And so this is a amphiarthrosis, and there are two subtype. The subtype of that is called symphysis. It's made by the fibrous cartilage, right? It's a fibrous cartilage. Yeah. Uh, it's because it's amphiarthrosis, so it allows small movement. It's not a lot of movement. Your two uh, pubic bone cannot move like freely, right? It can move. It allow you to a little bit rotate for your leg to uh, walk, but it cannot move too much. Yeah, so it helps to stabilize during walking. Uh, it also help with hormone re hormone re relaxing and expand to facilitate childbirth. Yeah. So yeah. So this is where that symphysis located. So here is the cartilage, fibrous cartilage right here. Here. So here is that disc, fibrous cartilage. Here you have the hyaline cartilage and hyaline cartilage, and here is that disc. Uh, in this joint, this is not just by itself, it also have the ligaments, as I mentioned earlier. There are ligaments, there are tendon to support the joints. And so you have the superior pubic ligament, inferior pubic ligament, and here is just remaining out of the bones. And so this is just a review of what we learned already. Here, this open is called uh, obturator foramen, all right? Obturator foramen is usually covered. And this is the pubic crest, and this is the ramus, right? The pubic ramus, inferior pubic, and yeah. And this is the pubic tubercle, and here is that line. This is a pectineal line. Yeah. So that's that. This is what's the functional classification? It's amphiarthrosis. And what's the subtype is symphysis. It's because it's fibrous cartilage tissue. Another one we can also find is in the intervertebral joint. Here you have that disc again. So here is the vertebra body, two vertebrae, and put together you have that. This allow you a little bit movement, so you can move it, but it's not like a lot uh, movement. So basically, it absorb any shock, absorb the weight, absorb, yeah. So so that's that. So this is a disc again. So if we look at that disc, we see there are cartilage tissue. In the middle is the Harding cartilage is called nucleus uh, pulposus. Outer portion is more fibrous. That's why we call it fibrous cartilage tissue. It's called annulus. Annulus meaning that is circling. Uh, annulus, fibrosis. Yeah. So that's that. So you basically, for this amphiarthrosis, you basically have that disc. Yeah. Not amphiarthrosis. It's amphiarthrosis, but the subtype is symphysis. Yeah, right here. Go back here. Symphysis. Right here. Symphysis. Symphysis. You can have a intervertebral disc and the pubic symphysis. Yeah. So that's that. So that's the second type. A little bit movement. Yeah. And we have two subtype. Syndesmosis, that's fibrous tissue, or symphysis, that is fibrous cartilage tissue. Yeah. So that's that. A third type is called diarthrosis. Diarthrosis. Diarthrosis allow you to have free more movement. Basically, all these movable joints are provided by diarthrosis. And so, as I showed earlier, you can see that you have one bone and the other bone and the bone meet each other. But when they meet, this environment is different. It's in the water, in the fluid. So allow them to have some lubrication. And so this is covered entirely by a capsule. We call it a synovial capsule right here. Synovial capsule. All right. Joint capsule. All right. Fibrous synovial. Yeah. Synovial joints have this joint capsule. All right. Easy peasy. Joint capsule. Joint capsule has outer membrane and the inner membrane. Outer membrane is called fibrous layer right here. Fibrous. Does it say here? Does it say here? Fibrous. Yeah, we will talk about that. Fibrous. All right. So that fibrous here, fibrous capsule. All right. Fibrous membrane, this membrane or layer, fibrous layer is continuous from the bone. Here's bone. Bone, you have the periosteum, the outer layer, continuing with this fibrous continuing to the other one. And so even though these two different bone, but their outer membrane are continuous through uh, the capsular membrane, and the outer layer is continuous from the periosteum. The inner layer is different. We have basically two layer, outer and the inner. The inner layer is called synovial membrane. Synovial membrane right here, synovial membrane. Synovial membrane can secrete fluid, provide fluid into this cavity. space, basically cavity. And two bones have the cartilage, so very smooth cartilage. So yeah, so that is that diathrosis. The only type, only subtype. There's no fibrous issue. There is no like fibrous connection or cartilage connection. They have this fluid space, synovial joints. Yeah, very unique, huh? Very neat. Yeah. So all of our joint, yeah, are made by this. Not all of our joint, but all these movable joints are made by this synovial joint. Yeah. So if you have any twist, any like uh uh injure, it takes time to heal because our body will have to rebuild this, not rebuild, like fix it. Synovial joints. Yeah. So so it has several components. The first one is the cartilage right here. Cartilage is on the surface of the bone right here. Cartilage, uh, cart cartilage, articular cartilage right here. Articular cartilage. Yeah. Uh, so here again, here is the outer membrane. Outer membrane is the fibrous membrane. The inner membrane is called synovial membrane. Outer membrane is, yeah, outer membrane is also kind of called fibrous capsule, right? A fibrous capsule. And this is the bone. This bone, the outer layer of the bone is called periosteum. And then in the surface of that bone, when they face each other, this is cartilage, articular cartilage, very smooth. Uh, and here is a fluid. Fluid is called synovial fluid, and that cavity is synovial cavity or joint cavity. Yeah, that. Here is the articular cartilage right here. So bone, when they face each other, this layer, this surface has this very slippery surface. It's called articular cartilage. Uh, the capsule has two side, outer and the inner membrane. And the outer membrane is called outer fibrous layer. It continues from where? Periosteum. It's continuous from the periosteum. How about the inner? Inner is a different membrane. It's called synovial. It has a function. It secretes the fluid. It secretes, produce the fluid. Otherwise, where is the fluid come from? Secrete the fluid. Um, they will stop at the edge of the articular surface, articular cartilage, right here, right here. So they stop here. So articular cartilage, they stop here. Yeah, and this the function is to produce the fluid, and the fluid is called synovial fluid. All right, synovial membrane produce synovial fluid that fills the joint cavity. Yeah. So the fluid has a function, lubrication, friction absorption reduction, right? So you have some fluid, it's easier to move around. It also produce nutrients because the joints do not have the blood supply right here. So inside of here, we don't have the blood supply. So to supply it, it comes from these cells, produce the fluid, and so it can nourishing this inner cavity area. Uh, shock absorption. Yeah. Uh, how do you so it's important that uh, because movement is important because you need to know that this joint doesn't have the flow, doesn't have the blood supply, so it can be pretty stagnant. And if it's stagnant, nutrients cannot coming in, metabolic waste cannot going out, and so when you move it, you allow this fluid to flow. When it flow, you allow them to transport nutrients to your joint. And so uh, when we sit whole day, it's not good for our joint. They will degenerate, they will decay. We need to move. All right, so exercise is important right here. So this is the secret cycle. You move, your joints is better. You also feel better. Yeah, move better, feel better. All right, so that is a secret cycle. Yeah. So, so what do we learn? We need to know that, okay, to help your joint is not to keep them on move. To help your joint, for your joint health is to provide movement. Yeah. So it's very important to know. In addition to that, we also have some other like a small piece. We don't usually have those in every synovial joint, but for the larger synovial joint, we may see those. One thing is called fat pads. Fat pads is located between outer and inner, between the outer fibrous layer and the inner synovial membrane. So this one allow, because for the larger joint, there's more space. And so you need to have something to soft things to provide some support. Yeah. So that is fat pads. Uh, in some joint, we also have like it's not a it's like a disc, but it's not a full disc. It's like a semi disc. It's called crescent shaped disc, but it's not disc. We call it pads, fibrocartilage pads. Yeah. So the name of these pads is called meniscus, right here, meniscus. So this is uh, we can find it in our knee. So here is the femur, and here is the tibia, right? The lower leg, and the femur sit on the tibia, and here is that articular cartilage right here, articular cartilage. Uh, and between these two, you have a disc. So it can absorb any shock, right? Absorb the shock. It's not entire disc. It's crescent right here, crescent shape. And so you still face this cartilage of the tibia, but you have some support, crescent shape, uh, meniscus. Yeah. So they attach to the tibia and the femoral condylar, sit on it, rest on it. From here, we can also see in the knee, we have the femur. It's just review femur, tibia, fibula. This bone is called patella. Yeah, so knee joint has many bones. Uh, Between these, you have the synovial uh, membrane to cover it, and inside of it, inside of that synovial capsule, you have the articular cartilage, you have the meniscus, you have lateral meniscus, medial meniscus. You also have tendon. You have two tendons inside of that synovial cavity. You have the front, we call it anterior cruciate ligament, not tendon, ligament. Tendon is to muscle connect to bone. It's ligament right here. Uh, and you another one is called posterior cruciate ligament, ACL and the PCL. So that's within. You also have some ligaments to support the joint. Here is the lateral ligament. This one will all the way. So this is outside of your uh, uh, capsule, all the way down to the fibula. Another one is called medial. Medial is part of the capsule. Medial collateral ligament, lateral collateral ligament. Yeah, so that's almost like everything you need to know. Yeah. All right. So ligaments. All right, ligaments. We have in the joints, we typically have three sets of ligaments. One is within the capsule, not in the joint. In the synovial joint, we have three sets of ligaments. One is inside of the synovial capsule. The other one is outside. The third type is part of the capsule. So there are three types. Part of capsule is called capsular ligament. Entirely outside is called extracapsular ligament. And the inside of capsule, inside of this cavity is called intracapsular ligament. So if we go back to the knee, we already know that this is inside uh, ligament inside of the capsule, uh, anterior cruciate ligament and the posterior cruciate ligament. So that's inside. And this is medial leg collateral is part of the capsule. This one is outside. This one, lateral collateral ligament, is outside of the capsule. So if we go back to the knee, we can find that there are some part of the capsule, some part of the capsule. Yeah. Part of capsule including the medial, right here, medial collateral ligament is part of the capsule. And the one that's inside is right here, cruciate. You have the anterior cruciate, posterior cruciate. That's inside, intracapsular capsule. And the extra is this one, lateral one right here, lateral collateral ligament. Yeah. So that's the ligament. It's important to support the joint. We also have something for the larger knee, though, larger joint, larger synovial joint, such as the knee. We have some other thing, but also and several other joint and the muscle too. The brucei is a fluid filled pocket, and so it's like okay, just you have space. We have those uh, fluid filled pocket put in there, and so yeah, so you can see that that's right here. Brucei is singular is brusa, plural is brusa. Brusa right here, brusa right here. So yeah, so you can find this brusa. Uh, there is a type of yeah. So you can find it between tendon and tendon, muscle and bone, skin and bone. Sorry, there should be a S. Skin and bones, and ligaments and bones. So between those space, brucei, brusa. So that's that. All right. So that is the introduction. We talk about three functional classification of the joints, and we yeah, and we got the overall understanding of the joints. And let's take a break. And the next one we are going to look into synovial because this one allow us to have is called diarthrosis. It allow the joint to have movement. So we were going to look at what type of movement and bone and bone connection has different uh, uh, arrangement. So we will also look into that arrangement. It's called the shape of the arrangement. Yeah, we will look into that in our next lecture. All right. So let's take a break and I will come back soon. Do the